All right, well, hi guys, and thank you so much for joining our webinar today. My name is Dhruv Singhal, the founder of Open Gears, as well as a sophomore at Mattia Valley High School in Aurora, Illinois. And it's fantastic to see that so many of you guys are interested in listening to the speaker today. So I hope that this event provides you with new insight and new knowledge. I would now like to welcome our speaker today, Dr. Alfred Atanda. Dr. Atanda is a pediatric orthopedic surgeon at Alfred I. DuPont Hospital for Children in Delaware, where he is the chief of sports medicine. He's excited to impart his advice on how you can be a successful medical student and a future doctor. Thus, I encourage you to extract as much as you can during this webinar, and please ask questions, whether you put them in the chat or unmute and say them. Thank you so much, Dr. Atanda, for taking time out of your busy schedule to help inspire students to pursue your STEM career. And without further ado, please give Dr. Atanda your undivided attention and a warm virtual round of applause. Dr. Atanda, you can take it away.
Yeah, so thank you, Dhruv, and thank you everyone else virtually. Unfortunately, with the pandemic and everything, we can't do this in person. But it is my pleasure and my honor to be here. And as Dhruv said, I'm a pediatric orthopedic surgeon that specializes in sports medicine. So we do a lot of ACL reconstructions, Tommy John surgery, meniscus work, cartilage work in the knee, treating young adolescents, middle school, college, high school age athletes. I also do a lot of work with physician wellness and physician well-being. As you know, being a physician is quite strenuous. It's a hard job to do when you're there, but it's also a hard road to get there. So I also work with a lot of the physicians in our organization to ensure that their experience and their well-being is promoted and optimized. But for a lot of you youngsters and students, we're not really putting the cart before the horse and focusing on the job. We're focusing more on the path to get there. Some of you may be middle school students, high school students, even college and even medical students already listening to this. And just real briefly, a few words of advice. It's a long journey, and it's going to have its ups, it's going to have its downs, but it really starts early on, when you're in middle school and high school, and really developing work ethic, developing good study habits, kind of focusing on what your long-term goals are, and really keeping your eyes on the prize and taking it every day at a time until you get to your goal. My advice to youngsters coming up is, in addition to doing well and getting good grades and doing well on, SATs and MCATs and other standardized tests, is really to try to make yourself a well-balanced individual. A lot of the admissions folks, whether it be at better high schools and colleges and medical schools, like to see that you're about something more than just, schoolwork. For example, someone like Dhruv is really putting himself forward by having this kind of endeavor that sets himself apart from other kids his age, and finding something that resonates with you, that you're passionate about, that gives you joy, that you can do, that may be a little bit non-traditional. I think is very, very key and very helpful when people are looking at you, because at this day and age, everybody gets good grades, does well on their SATs, does well on their MCATs, they do research, they shadow physicians or other professionals, but you want to really find that niche and that edge. That's something I wish I did. I was just a regular kid. I went to school, I did my homework, I got good grades, I played sports, and that was that. But if you can find something that sets yourself apart from your peers, I think that'll be most helpful. Other thing is that we talked about this being like a really long journey, and really surrounding yourself with good, positive people, whether it be your family, friends, neighbors, people in your community, that can help you and shepherd you along this journey, because you can't do it all by yourself. It's a mental and emotional grind as well as a physical one. Being up late, studying, working hard obviously takes its toll physically, but just a mental capacity of staying focused, whether or not you're doubting yourself, having an appropriate self-confidence and self-esteem to make sure you get through there. You're going to need people that can be in your corner and support you and help you. Another big thing I recommend, regardless of the profession that you're trying to go into, obviously I'm a physician and a surgeon, but if whatever profession you're looking for, I would try to find a way to shadow and observe those people when you're young. Make sure that it is in fact for you. It's something that you can envision yourself doing. If it is being a physician, shadow your own pediatrician or your own physician and hang out with them. If you have a family friend or a family member that's a physician, you can maybe pick their brain, hang out with them at work for a couple of days and just kind of see what they do. That's one big thing I regret. I never did that at all. I mean, I never set foot in a hospital to observe or to learn until I was in medical school. So for all those years of college and high school, I missed out on a lot of potential opportunities. Um, but yeah, I just wanted to kind of say that to begin with. I know Drew has some questions geared up. I don't want to keep babbling on, talking endlessly. I want you all to kind of reach out and let me know what's on your mind, and hopefully I can get through some of these questions and help address any concerns or fears or uncertainties you have about the process of becoming a physician.
Yeah, of course. So once again, it's just a reminder to the audience that please feel free to ask questions throughout this webinar. I really appreciate your engagement during this webinar. But in the meantime, I can get started with some of my own questions. So Dr. Atanda, like you started talking a little bit about what pediatric orthopedic surgery is. Like, can you dive a little bit more in depth about what the field is like? Do you just treat like sports injuries only? Like, what are the different types of operation, types of work that you do?
Oh yeah. So definitely, just to give you a little bit of a spiel. So in the path of medicine, as a lot of you may know, you start off with the 4 years of medical school and just learn everything about all the different divisions and subspecialties of medicine, whether it be internal medicine, pediatrics, obstetrics, general surgery, orthopedic surgery. Then after that, you gravitate towards a residency. Orthopedic surgery is 5 years of general orthopedic surgery knowledge. So we do everything from hand surgery, spine surgery, foot and ankle surgery, tumor surgery, sports medicine surgery, joint replacement surgery. And after those 5 years, that's when you do subspecialization if you're interested to really hone your skills in a certain area. So for me personally, after 5 years of orthopedic surgery, I did 2 more years of fellowship training. So I did 1 year of pediatric orthopedic surgery, and I did 1 year of sports medicine surgery. So pediatric orthopedic surgery has its own further subspecialization. So within peds, again, there are a lot of different problems and conditions that affect kids that don't affect adults. Obviously, trauma is a big thing. Kids fall and break bones. Some of you all may have broken bones or torn muscles or torn tendons. There's kids who have congenital hand problems. There's kids who are born with like club foot and flat foot, different foot injuries. Kids who are born with scoliosis where their spine is curved. Kids who have like bone tumors. Kids you may have seen like dwarfs, like short stature, little people who are born with congenital anomalies of their bones and their growth plates. And then there's athletes, kids who are playing sports, and that's where my focus comes to. So this is a long answer, but the types of surgeries and procedures that I do mainly are arthroscopic procedures, so minimally invasive procedures where we take cameras and little instruments and put them in through like 4 or 5 millimeter portholes into different joints where we can address cartilage issues, ligament issues, meniscus or labrum issues. You may have heard of those things. So in the knee, we do a lot of anterior cruciate ligament reconstructions. We treat cartilage problems, people whose kneecaps pop in and out. We treat shoulder ligament and shoulder labrum tears, but mostly things that involve, a minimally invasive approach. Obviously, I do open surgery as well, but my forte and my specialty is arthroscopic surgery.
Awesome. So it seems like as a pediatric orthopedic surgeon, you work around like all parts of the body, from like your shoulders to your knees, and with a lot of like sports injuries and athletes too. But why did you choose to pursue pediatric orthopedic surgery and not just general orthopedic surgery, where you work with like adults and people who are more older?
Right. Yeah, that's a great question. And so growing up, I always loved working with my hands, and I always loved fixing things and putting things together. I always had a hammer in one hand, a saw in the other hand, a screwdriver here, drills. That really fascinated me. So when I got into orthopedic surgery, it was now okay. Well, now what? What's my specialty within this going to be? And I really gravitated towards kids just because kids. They're just so grateful and just so thankful to be alive and to be healthy and to be running around. Adults are a little bit tougher to deal with, as you can imagine. But kids, they work very, very hard and they're very resilient. Sorry, there's some background noise. And they really just want to get better. And it was that, you know, that's really what motivated me, to just see these kind of innocent kids with problems that they don't even know why they have them, and really be able to get them back to whatever level of function that they had. So like your average 15-year-old kid who's in high school, plays sports, bam, one day they tear their anterior cruciate ligament or their Achilles tendon, or they break something. Their life and their world is kind of shattered, because that's everything, who they are, that's what they do, that's all they know. And as an orthopedic surgeon, to be able to kind of swoop in and in some finite period of time be able to do a procedure and then watch them rehabilitate and then get right back to whatever they were doing, that was very gratifying and satisfying for me. I liked treating more acute problems that could be treated definitively very easily, as opposed to kind of long-term standing problems that we have, like chronic conditions more so, that we see a lot of in adults. So I just felt that that was a little bit more fulfilling, to tackle kids. And then the athlete perspective, I grew up playing soccer my whole life. My family's from Ghana originally, in West Africa, and there's 7 of us kids, and all the boys played soccer. So being around athletes and being an athlete was something that always resonated with me. So coupled with my own personal experience and my professional experience and some of the interests that I had as an orthopedic resident, it seemed like a great fit to take care of kids and to take care of athletes while I was an orthopedic surgeon.
Yeah, I definitely agree with you. Like when it comes to like treating kids and just being able to make an impact on their lives, you get this huge sense of reward, this sense of um, satisfaction and relief. Is there a difference between the way you treat children compared to treating adults, and like the way like you do diagnosis and other sorts of work?
Yeah, I mean, the biggest issue is that kids are kids, so they can't really make decisions. They're under the age of 18 for the most part, so they can't make decisions for themselves. So the biggest difference is that you have to deal with their parents to manage what happens to them, to counsel them, to educate them, to get permission to do procedures on them. So that's always can be a struggle depending on the relationship with you have with the family. But in terms of the bread and butter um, surgery component, the biggest thing is that kids are still growing, so they have growth plates in their bones. I don't know if you've learned that in science class, but kids who have open growth plates, and your body lays down cartilage and then turns it into bone over time. That's how your bones get longer and wider. So when you're doing different surgeries and procedures and using drills and hammers and saws, you can't just kind of go around doing all sorts of stuff, because if you damage those growth plates, then the kids are not necessarily going to heal in the correct way, and their limbs could be angled or shortened or whatever. So that's like the biggest difference, is when we're doing surgery, we have to respect the growth plates. The other thing is that kids, in a positive way, is that they tend to be, their quality of their tissue tends to be very good, because they only been alive for 10, 15, 20 years. So they don't have like long-term chronic degenerative changes. So for me as a surgeon, it makes it easier to cut through their tissue and put screws into their bone, and put anchors and suture into their soft tissues. So that's actually a lot easier and more pleasant. And the last thing is that they heal pretty well. So specifically when you're looking at fractures and bones, I don't know if any of you have ever broken a bone, but kids, for the most part, you just put them in a cast, hold the arm and the bone and the leg and the bone somewhat reasonably straight, and a lot of times it'll heal and straighten itself out. Whereas us adults, we don't have growth potential. So if I break my forearm, it's not going to grow. I mean, it'll heal, but it's not going to grow and straighten itself out. So I have to align it perfectly with a plate and screws or a rod while it heals. Whereas kids, you can just put them in a cast and just let things kind of mold themselves back together. So, that's very beneficial from a surgical technical standpoint.
Oh wow, I never knew that there were like so many differences between treating a child and treating an adult. So thanks for bringing insight into that.
No
So
problem.
he wants to know about like what's a day in the life like for you as an orthopedic surgeon. What are your work hours? Like, what do you do on a typical
Mm-hmm.
day?
Yeah, so most surgeons are pretty busy, and we work a lot. And thankfully, now that I'm an attending practicing surgeon, it's typically 5 days a week. Sometimes I take call on the weekends and operate on kids who've had emergency injuries and need emergency surgery. But for the most part, we're probably in at around 6:30. It's actually been helpful because of the pandemic, because a lot of what we do is virtual. So I can go to conference like this at home. So I don't have to wake up and shower and drive half an hour to work to be there at 6 o'clock. I can just kind of wake up at 5:50 and get ready. So that's been nice. But typically it's around 6:30. On a surgical day, surgery start around 7. and go till around 5, 6 p.m. Now, depending on the types of surgeries, if it's a spine surgery, it's usually one long surgery or two long surgeries you do all day. My surgeries, thank God, tend to be pretty quick, so they're like an hour or two, so I can do 3 or 4 of them in a day, and then you kind of have downtime in between the surgeries. But it's around 7 to 5, 7 to 6 p.m. For like a clinic day, like when I'm seeing patients in the office and talking and evaluating patients, that usually starts at 8 o'clock, and that goes to around 4:30, 5 o'clock. For me personally, I would see probably around 20 to 25 patients in a day with various, problems. Some of them are brand new patients I've never met. Some of them are patients who I know and I've operated on them and they're just coming back to check in, or people that I've seen before and I'm just following up with them. We see them and we interact with them and help them diagnose or help them learn a little bit more about their problems. So that's like the general work week. Every now and again, we do take call. So at night, I'm not in the hospital like I was when I was a resident, but I'm at home and I'm available via computer, via phone to look at x-rays, to help the residents who are in the hospital. And if it's a surgical problem, then I go back in and I do the surgery, which can be tough because then the next day you have to work. So that can be pretty tiring. That only happens like probably 2 or 3 times a month where you take call overnight during the week. And then once every 2 or 3 months, you would take like a weekend call. So from like Friday night at 8 or 5 p.m. to Monday morning at 8 a.m., you're on call the whole weekend. And you do it from home. I'm with my kids and my family, but if people need me, I have to answer the phone, I have to look at images, help guide the residents that are in the hospital. And then if I have to go in and do surgery, then I'll go ahead and do that. So it's not terrible, but it's not easy either. And there's definitely a lot of hours that go into it.
So you do employ a lot of telemedicine practices, right? Like, could you explain a little bit more about telemedicine and how you work with that?
Yeah, telemedicine, I've been doing telemedicine since way before it was cool. I started in 2015. And of course, the pandemic hit. Now it's a household name. But basically, the idea behind telemedicine is moving knowledge and information to the people that it needs to get to. In the traditional sense, you get up and you go and see the doctor, and then you leave. But if you can imagine, people have to go to school, parents have to go to work. Sometimes you live 100 miles from the doctor. So it's not always a physically practical and convenient thing to do. And if you can get the information and the knowledge that you need virtually, such as this, then that's very helpful because it saves time, it saves energy, it saves resources. Now, for brand new patients, we typically don't do telemedicine visits just because we want to lay our hands on them. We want to arrange their joints and palpate things and feel things and get a rapport with them. But by and large, I use telemedicine for patients that are established to me or patients that I already know. So people who I've seen, but they just, they got an MRI of a knee and they just want the results. People who are about to be scheduled and signed up for a surgery, but they want to talk to me and have a surgical consultation so they can ask questions. People who have had surgery, and they just need to do a quick follow-up. I just need to look at their wound. I need to like watch them range their elbow or something. All of that can be done quite easily, virtually and safely, all from the comfort of their own home or wherever they happen to be. I mean, they don't even have to be at home, and I don't have to be at the hospital or at home. I can be here now, sitting in this hotel lobby, and I can interface with a patient of mine and talk to them and ask their questions, just like I'm answering your questions, and give them that knowledge that they need. So that whole paradigm shift of moving knowledge and information, as opposed to moving people, is something that's really set off telemedicine. Obviously, the pandemic helped move that along, but in orthopedic surgery specifically, it's very helpful and ideal because most of our decision making is made off of imaging, x-rays, MRIs, CAT scans. And as you know, with this day and age with technology, it's very easy to move images, and knowledge associated with those images. So it's been very helpful.
Yeah, I do agree that technology has like emphasized the need for telemedicine because you can connect with so many people, and you
Mm-hmm.
don't have to be at the hospital. Like, I could be talking to you, and like I could be like I could help diagnose something just with the need of a computer. So
Right.
medicine has been growing, and that's really fascinating. So, as an orthopedic surgeon, do you do a lot of like paperwork, any writing, any research?
Yes. Yes, yes, yes. So I'm at a research conference. I'm at the Pediatric Orthopedic Society of North America. It's our big flagship meeting that we have. I belong to this conference. There's a general orthopedic meeting. There's a sports medicine meeting that I go to every year. There's a pediatric research and sports medicine meeting. And there's also an American, like a telehealth meeting that I go to. So I go to about 4 or 5 meetings a year. At those meetings, we try to present abstracts, get on the podium. I presented yesterday on some of the work that we've been doing with telemedicine here to our colleagues. We publish manuscripts that we put in scientific journals. One of our telemedicine papers were at the finishing stages to submit it for publication. I wrote the world's first telemedicine and orthopedic surgery textbook, and I published that in December of 2020. And that took about 18 months of hard work and collaboration from about 20 other physicians and PhD folks around the country. And that's been very key. But a lot of that stuff takes up time, so you have to carve out time to work full time, to be a parent full time, to be a person full time, but also to have scientific and academic endeavors. And a lot of the success that I feel people in my situation have is really about organization skills and time management. Obviously you have to know about orthopedics, you have to know about your specialty and your craft, but you also have to know how to manage and prioritize your time just to get through the day. I'm sure you do that just as a high school student, getting through the day, knowing when to study, knowing when to do your schoolwork, and knowing when to have fun and exercise. It's the same thing as a surgeon, but it's like 1,000 times more complicated because you're a parent, you take care of other human beings at work, you take care of human beings at home, you take care of yourself, you have to find time to watch TV, find time to exercise, but also you got to hit the journal articles, you got to read them, you got to write your own journal articles. So yeah, we definitely do a lot of that in academic healthcare, but really finding those organizational skills and those prioritization skills is going to be very key and helpful.
Yep, indeed. So I want to shift gears and talk to you a little bit more about your education path. People
Mm-hmm.
want to know what you majored in and what did you study in college. So could you just shed light on like your education path toward being a pediatric orthopedic surgeon?
Totally. If there's anything I know about, it's school. I may not know much about orthopedics, but I do know a lot about going to school. Holy smoke. So yeah. So I graduated high school at the age of 17, and I did not get my first job till I was 32. So for those of you that can do math, it's 15 years of schooling after high school. And I spent 4 years at the University of Virginia, where I majored in biochemistry down in Charlottesville. And then I went to University of Pennsylvania, or UPenn, in Philadelphia, where I studied medicine. I went to medical school. Um, and then obviously I had to do my residency after medical school. That was 5 years at University of Chicago Hospital in Chicago, Illinois. And then again, I told you I did fellowship. So I did a year of training in pediatric orthopedics at Alfred I DuPont Hospital for Children, where I work now, but I trained there for a year. And then I also trained at the Rothman Institute in Philadelphia at Thomas Jefferson University for a year doing sports medicine surgery. So for those of you sports fans, we took care of the Eagles, the Phillies, the Flyers, all the professional sports teams in Philadelphia. I got to operate on them for a year, which was key. So as you can imagine, from the day I graduated high school to the day I got my first job, not only was I in all over the country, I was at all these different levels and phases of schooling and training that really spread the gamut of all the different kinds of things that I can learn. But I guess the thing that set it off was really college and majoring in biochemistry. Now, I always felt that, you have to major in something scientific to go to medical school because a lot of the prerequisites and such to get into medical school are science related. So if it's a biochemistry major, I took a year of physics, a year of calculus, a year of chemistry, inorganic and organic, a year of biology, and you need all those things to get into medical school. So it kind of killed two birds with one stone. But my advice now that I've gone through it and I'm a little older is, really make sure that you kind of spread yourself a little thinner and open and broaden your horizons when you're in college. Because it's really the last time that you're going to get to learn like all this random stuff. And I never really took like economics classes or like business classes or like sociology or philosophy classes. And I wouldn't really use that now in my job, but I think it would have been nice to just dabble in some non-scientific things. That's my personal belief. But I do think it's kind of easy if you're a scientific person and you're going to medical school to gravitate towards those things. But I would say kind of venture outside of your comfort zone a little bit, and because those things, they may not help you, ace the MCATs or any of the medical standardized tests, but knowledge is power, and the more you know and the more you have, the better off you're going to be. So that would be like a little bit of a tip to think about as you all who are in high school who are thinking about what to do when you're in college.
So in order to prepare for like the med school rigor, did you take a lot of science classes in the areas of biology and chemistry?
When I was in college, you mean?
Yeah, when you were in college.
Yeah, like I said, yeah, I mean, I took a lot. I did the mandatory prerequisites for medical school, but I also went above and beyond because I was a chemistry major and I took like, we start out with 100 and 200 level courses, which is all what you need for med school. But I took, 3, 4, even 500 level science courses, whether it be biochemistry, physics, higher level biology classes, chemistry classes. But to be honest with you, you don't have to do that. I mean, there are plenty of people who I went to med school with at Penn who majored in English and majored in history or majored in mathematics or economics or statistics and they just they did the basic amounts that you need to get in and then they did other stuff because you're going to kind of hit the ground running and be reworked in medical school and do all that stuff again. We don't take physics in med school, but or chemistry either. We took biochemistry for a little bit, but you don't take like bio in med school. It's more like cardiology, pulmonology, gastroenterology, and they have all of those classes and those topics and principles woven into that. So I don't think you're at a disadvantage at all. I mean, I think you can go either way. Either way, you're going to have to work really, really hard in medical school. You're going to have to learn a lot. You're going to have to really do a lot of time management and study prep and really learn how to master a lot of these tests that are going to be put in front of you. And studying science and majoring science will help, but it's not, in my mind, something that you have to have. I mean, as somebody who studied biochemistry, I don't think medical school was easy, because I did that. It was still a grind and still a challenge. But you got to, think about what works best for you and how you learn and what you want to get out of the college and medical school experience. I mean, obviously, you have to do the prerequisites, but also think about what you like. Think about what brings you passion and what brings you joy. Because again, college is done. Like I would do anything to go back there, but it's like your 1 4 year period to really learn as much as you can.
Yep, exactly. Like, extract as much as you can during college because that gives you more specific knowledge into, the field that you want to pursue. So,
Right.
you gain exposure to other fields in medicine before you settled on choosing pediatric orthopedic surgery.
Yeah, I mean the beauty of that is so when I was in medical school, um, 10 was nice because you spend a year and a half or 18 months in the classroom, and then you spend the last 2.5 years in medical school doing hands-on medical work. So you're on the ward, you're seeing patients, you're working with physicians. Most medical schools are 2 years in the classroom, 2 years in the wards. We did only 18 months in the classroom, which was nice because 18 months is a long time to be studying and taking tests and cramming all the time. So, and you're there to learn how to be a physician, and you're there to see patients and connect with patients, and that's the key. So that 2.5 year period, I saw everything in medicine. We did rotations in internal medicine, pediatrics, obstetrics and gynecology, family practice, emergency room, surgery, ophthalmology, dermatology, really psychiatry, anything you can think of. Some of it, obviously, we did more than others. A couple of things we just did for like a week or two. And then some specialties like internal medicine we did for 3 months. But you definitely get to see everything and see and examine and evaluate patients and be tested on everything. So at the end of that 2.5 year period, you really get a good sense of what you like and you don't like. Big thing for most people is whether you're going to be a surgeon or somebody who does procedures or not. That's usually the big fork in the road. So once you figure out, oh, am I going to be working with my hands and doing procedures, or am I going to be strictly in the office seeing patients? That helps narrow down your decision of what you want to go into significantly. And for me, I was always gung ho surgery and procedures. So I kind of went towards that route. And then when I got there, it was like, okay, well, am I going to do orthopedics, neurosurgery, plastic surgery, urology, head and neck surgery? Um, Orthopedics, like I said, I mean, people have a finite definitive problem and you fix it and they get better and you can really improve their quality of life and their function. And I was always kind of gravitating towards orthopedics just from my own experience as an athlete and injuries. But that's what appealed the most to me. All those other specialties tend to deal with a lot of sick people that have terminal diseases and can die, a lot of cancers. It's a significant problem, specifically in general surgery, because they operate on the chest, and the heart, and the lungs, and the abdomen. I like more kind of simpler problems where people are hurt and they're struggling, but they're not likely to die or pass away. So that's kind of how I narrowed down that path. But yeah, long story short, you definitely get to see everything in medical school, and it'll help your decision making process.
So after you explore all these medical fields after those like 2.5 years, there's a difference between this education that you receive as someone who wants to do surgery compared to the education that you receive like when you want to strictly do patient care, right? Like there's a
Uh,
difference.
it's pretty similar. It's similar. I mean, we all went to the same medical schools. You do residency depending on what you would like to do. I mean, if you're going to be like a pediatrician and take care of kids who are sick, and just like you all have pediatricians, most of those folks are not doing procedures. Their residencies tend to be a little bit shorter, like 3 years. The surgical procedural based residencies often tend to be a little bit longer, so like 5 years. But for the most part, I mean, the education is the same. In terms of the time commitment, it's just and it's busy. But if you're a procedural kind of person, you have a couple more years. But they're all mandated and governed by the same like national bodies. The Accreditation Council for Graduate Medical Education oversees all residency programs, whether they be surgical or non-surgical. Um, so yeah, I mean, we're kind of all under the same umbrella, but we all have like little different divisions and factions that we belong to.
Yep, I understand. So, did you participate in any sort of extracurricular activities in college and high school that shaped your interest in medicine?
Uh, I mean, it's interesting because when I was 17, I was a senior in high school. I watched the video in my anatomy class, and it was about a orthopedic surgeon who went to, I believe, Haiti, somewhere in a third world country in the Caribbean, and he was doing surgery on a child. And now that I look back, the child had something called congenital pseudoarthrosis of the tibia. Basically, his shin bone was kind of malformed and malshaped, and it had to be straightened out. So he put what's called an external fixator on the leg, and there's like all these pins and bones sticking out. And over time, he cut the bone and corrected it and rotated it. And I was fascinated. So when I saw that, I was hooked. I was like, I want to be a doctor. I want to be an orthopedic surgeon. So there weren't particularly any things outside of that that pushed me towards being an orthopedic surgeon. But since I knew that's what I wanted to do, I kind of picked extracurricular activities that helped me put my foot in the door to get into an orthopedic surgery career easier, if that makes sense. So I did a lot of scientific type stuff. So when I shadowed like a lot of science people, so I did lab work in college. I like general bench type lab work. I did organic chemistry and inorganic chemistry research in high school. I'm sorry, in college. I did summer research programs that were geared towards kids interested in the sciences and into medical school. I did every summer after college for after second year, third year, and after my senior year. I did a 10-week long program. All these things to help kind of boost my resume and my CV, and just to have some outside non-traditional things. So they were mostly geared towards science. I mean, I played sports and belonged to different clubs too. I played music. I played the trumpet and the piano. Done that most of my life. So I did those things too, to try to make myself a little bit more well-rounded. But I tried to find those kind of formal, mostly summer programs that you can do where you can meet a lot of contacts, you network with people. I mean, there are people who I met when I was 20 in those summer research programs that I still know to this day, that are also physicians like myself. So kind of setting yourself up for success early on by doing some of those extracurricular activities is key. And now, again, it didn't push me towards medicine, but I used them in my path that I already was on, that I knew I wanted to become a physician.
Right, you used your extracurriculars in order to like put your feet right into the field that interested you at that time, which was
Right.
pediatric surgery. So I'm assuming that you did some testing in order to get into medical school, right? The MCAT,
Hmm.
that's necessary.
Yeah. So to get into medical school, as you know, as a high school student, to get into college, it's the SATs. If you're on the East Coast, I guess I forgot the other test, ACTs. what they do less, I don't even know. But basically, there's some big tests you all take. Most people the SATs, and then get into medical school. Yeah, it's the medical college admission test. You usually take that your third or your junior year of college, somewhere around there, maybe your senior year early on. That's also a grind. It's a lot of studying. Most people take like Kaplan or Princeton Review board prep classes to do that. I did Princeton Review for about 6 or 8 weeks before taking that test. Yeah, and it's hard because you got to do your regular coursework. Like you're still in college. You don't stop college for 3 months to study for the MCAT. So I had to do my regular coursework in addition to studying. What I did was my second semester or the spring semester of my third year, I was going to take the MCAT in April. So that particular semester, I took a very light course load, took like 3 or 4 classes just to kind of maintain the minimum. So I wasn't so overworked, so I can study for the MCAT a lot. And then I made up that time before and after that semester. You know, I took more courses before and after so that it all evened out. But again, it's about setting yourself up for success and having a strategic plan. You know, I knew I wanted to go to med school. I knew I had to take the MCAT. I knew I had to do good on it. So I had to put myself in a position where I was as free as possible to study as much as possible for the MCAT. And again, you still have to go to school. So you have to still take coursework. Sometimes you can take the MCAT in the summertime too. So some kids would devote their whole summer just to studying for the MCAT and take it in August right before they go back to school. I personally didn't want to spend my whole summer studying. I wanted to have fun and be a kid. And I also knew that I was going to do a summer research program. That particular summer after my junior year, I went to Harvard and did the summer honors undergraduate research program at Harvard Medical School. So I knew I was going to do that for 10 weeks. So I couldn't study for the MCAT all summer. So I had to do it during the school year. But yeah, in college, that's like a big thing that you think about. You eat, sleep, and breathe the MCAT when you're trying to go to med school.
Yeah, and that does emphasize the need for you, like you said, Dr. Atanda, that like one needs to manage their time well, right? Like you study for the MCAT, like you need to be able to manage the college coursework that you currently are doing with the necessity of studying for the MCAT. So I
Right.
think perfectly. So like now shifting gears back to like your life as an orthopedic surgeon. So could you talk a little bit more about like some of the technical skills that you need to know, certain like any technologies, technical skills that you need to know?
Yeah, I mean, you have to be good with your hands because everything you do is with your hands, whether it be evaluating and examining a patient, or whether it be obviously being in the operating room and using a whole litany of tools and instruments. You have to be somewhat ambidextrous because you have to, they always say it's to be a two-handed surgeon. I don't go in there and put my left hand behind my back and operate with my right hand. My left hand, I'm right-handed, but my left hand is doing just as much work, especially for us doing minimally invasive surgery with like little tiny holes that you're putting little portals and cameras and things through. You're doing a lot of work through these tiny little holes. So it's almost kind of like playing video games. A lot of people say that arthroscopic surgeons were the ones who spent a lot of time playing like Xbox and PlayStation and all this stuff when they were growing up because they have all this hand-eye coordination. Specifically for me, I'm always looking at a screen, like a TV screen, looking up, and then I'm kind of using my hands doing things. So hand-eye coordination and physical technical skills with your hand is probably the key, but that's just for surgery. The outside part of that is you got to have people skills. You got to have the ability to communicate with a whole host of different types of people, and I would say orthopedic surgery is like 10% of my job, where 90% is interacting and communicating with other people, whether it be patients, families, family members, nurses, staff members, other doctors, receptionists, secretaries. You're constantly talking and engaging with other people. And that's one of the downsides because in medical school, nobody teaches you how to communicate. They teach you anatomy, they teach you physiology, they teach you all the organ systems, you learn all this knowledge, take your standardized tests, but then you get thrown to the wolves and you start your job. And if you're like not the best communicator, I don't care how smart you are, you're going to struggle. So one thing that I would focus on is, and even for those of you going in college, like figure out ways to take communications classes, figure out ways to take like a public speaking class. You're going to do that a lot in residency and medical school. And it's not public speaking in the sense that like, oh, okay, I'm going to give a speech about, World War II, but you're going to get up in front of people and communicate knowledge and information. You're going to be put on the spot in a medical school class to answer a question. You're going to be on rounds as a new intern on the general surgery floor, and the attending is going to ask you X, Y, or Z, and you have to be able to communicate and perform. And again, it doesn't matter how smart you are. If you cannot communicate effectively, you're not going to make a successful surgeon. And there's no ifs, ands, or buts about it. So I would find the time and the energy to get good at it. And if you're not good at it, that's okay, but you can practice and find ways to get better at it. And that's what I would say is probably the second biggest part. Obviously, hand-eye coordination and using your hands is huge, but effective communication is key. I mean, if I'm going to go up to a patient, 10 years old and they have an injury, I have to convince their family that I can do this procedure well, that I can help them, that I can minimize risks and complications, that I'll do my best to take care of them. And how are they going to know that unless I tell them, right? They can Google me and look me up, but you have to convey this persona of expertise and make them comfortable. And you have to do it in a short amount of time. When you're in the clinic, I mean, you don't have an hour for every patient. You have like 15 minutes to meet somebody, figure out their problem, convince them that you are the right person to do the surgery, and then move on to the next patient. And that's a skill, just like anything else. So that would be probably, I would almost say it's more important than hand skills and knowing how to use drills. I mean, you can teach a monkey how to drill a screw into a bone, it's only like one way you do it. You turn the on switch and you push it and there it goes. But the savviness to have the emotional intelligence and the social etiquette to really interact with human beings all day and read their faces and reassure them and guide them and help them and make them feel comfortable. I mean, that's like extraordinarily hard. And I'm 10 years into my practice as an attending surgeon. I'm still learning every day, and I'm still trying to be better, and I'm still trying to improve myself. So those are probably the two biggest things that I would say that you need to be successful. I mean, there are other things too, obviously, but those are the big things that come to mind.
Communication is really important. I think it's not just in pediatric orthopedic surgery, but it's also in like other fields too. Because if you have all the knowledge in the world, but you cannot communicate it effectively, then all that knowledge goes into waste. And
Right.
like you said, Dr. Atanda, that you need to be able to convince your patients that you are the right man for the job. So again, having those people skills is also really important. So
Totally.
talk a little bit more about like what was one of your most unique and most interesting experiences as a pediatric orthopedic surgeon? Like you can talk a little bit about like one interesting experience that you had.
Um, I mean, there's a lot. You mean like with like a patient, like after surgery or something like
A
that?
patient, like any interesting case that you had to solve.
Uh, let's see. So probably, I would say, I mean, most of the cases that I do aren't particularly hard. We usually get MRIs and we can see a lot of the pathology and the injuries on them. We don't solve a lot of mysteries. Um, I don't have one particular case, but I will tell you this. One thing that I've learned in my career is how intricately involved the mind and the body are to one another. And what I mean by that is your mind is very fascinating in the sense that when your mind feels and experiences stress, that stress is manifested in so many different ways. And what we found very early on in my program and my practice in sports medicine, that there are a lot of psychosocial stressors that affect young kids that manifest as joint pain and knee pain and elbow pain. And I didn't realize that. When I first started my job, I was like, oh, your knee hurts. We're going to get an MRI. We'll look to see where the damage is. We'll go in there, we'll do surgery, and we're going to save the day. But what I realized is that, you may know people that have chronic headaches, chronic belly pain, chronic back pain. There are a lot of people out there that have different stressors in their lives that manifest as knee pain. And if they happen to play soccer and they're 14 and they're running around all the time and their knee hurts, well, they send them to me because they think that I'm the orthopedic surgeon and I'm here to save the day. But what I actually realized is that there are a lot of kids that are struggling with things like anxiety, depression, maybe a death in the family, bullying at school, eating disorders, all sorts of stuff. And that pain probably 10 to 20% of the time that the pain that they're experiencing is a result of that. And it's not that they're making it up, because they have real pain and they're really debilitated by it. But you get MRIs and CAT scans and even go in and do surgery and you don't see anything. And over time, initially, I was thinking, man, these kids, maybe they are making it up because I didn't find anything. But I've learned now that I work with a lot of our psychologists um, in our pain management program, that they help me figure this kind of thing out, because it's a very real thing. And again, it's not like one particular case, but it's one aspect of my career that I was never expecting to chance upon. And, oftentimes I can be very integral in how they get better, because I can acknowledge that, hey, listen, they've seen 2 or 3 other doctors, they've had all these scans, they don't have anything. And then I can take the time to dig a little deeper and say, okay, well, there are psychosocial stressors in people's lives that can manifest as knee pain. Is this something, how's your home life? Is there anything that you're dealing with? And it's a little bit out of my comfort zone. I'm not a psychiatrist or a psychologist. And again, as a surgeon, time is money. You're in and out of these rooms, you're moving along so quickly. You may not have a lot of time and energy to delve into some of these topics, but it's really, really key, because if you don't really do that, A, they're not going to get help, and B, people are going to operate on them unnecessarily. And that's something that's really changed and revolutionized my career, because I've realized that orthopedic surgery wasn't so simple. I realized that it's not like, oh, well, you have a meniscus tear, cartilage damage, you're doing surgery, we'll fix you up and you'll be fine. The human body is absolutely amazing. So that's probably the most interesting, unique aspect of my job is, oftentimes I almost feel like a family therapist, because the kids come in, there's no actual orthopedic pathology causing their pain, but they're still having pain. And I help them work through that. I help them work through the frustration that they're having because they can't play their sport or do what they want to do. I help the parents, because I'm a parent myself and I know how hard and frustrating it is to have a child that's in pain that you can't help. So oftentimes it's almost like a family therapy session. So that's worked out very well. And that's been a huge kind of revelation that I've had in my career, that I always try to pass on and share.
Yeah, I think that's a great point that you brought up, Dr. Atanda, that like on one side there's like the technical part, like you need to work with your hands, you need to be a good communicator. But on the other end there's like that emotional side where you're
Mm-hmm.
trying to, motivate the kid to, get back on their feet and continue their sport and, being able to communicate things that may seem like, tough to say in a way that seems a lot more motivational and more positive.
Mm-hmm.
So, like, do you work with a lot of engineers on your job, like, especially good biomedical engineers?
I personally don't work with biomedical engineers on a day-to-day basis, but we use a lot of implants, tools, drills, screws, plates, rods that are designed by companies that are full of biomedical engineers and structural engineers. So I work very close with them, just not like on a day-to-day basis in the operating room. I'm here at a conference and there's lots of company representatives that have an exhibit hall here where they're displaying some of their devices and some of their tools, and some of those folks, I mean, they're sales reps, but some of them also are engineers, structural engineers that we can ask questions and they can show us different samples of tools. So engineering, I mean, there's so many orthopedic surgeons that majored in engineering in college. I mean, it's probably, outside of biology and chemistry, it's probably like the top major, because it's definitely, we learn a lot about engineering principles. We learn about how tendons and bones fail, how they break, how they stretch, how they tear. We also learn about how plates and screws fail and break, and how we can insert them and get them to be tighter and fasten better. You need some sort of semblance of basic engineering principles and knowledge to be facile with a lot of what we do.
Yep, I totally agree with that. So what would you do differently if you could go back in time? Was there anything you'd wish you'd known when you started out as a surgeon?
Yeah, if I can go back in time, I would probably not take myself so seriously. I was so, and like a lot of other students and kids, I was so focused on becoming an orthopedic surgeon. And I think it's a double-edged sword. You do need to have that focus and drive. But I feel like I missed out a little bit on the world around me. I think I could have had a little bit more fun. I think I could have just enjoyed being a kid and just enjoyed my youth, in my 20s in college. I probably didn't have to study, 6, 8, 10 hours a day. I think 3 to 4 hours a day would have been fine, and maybe ratcheting it up before big tests, but then dialing it down a little bit after tests, and just kind of being carefree. You obviously can't do that all the time, but I think just having a better balance of how hard I worked and knowing how to turn it on and off, I think would have just made life a little bit less stressful and a little bit more fun when I was young. I turned it up 110% for 15 years, and then I went full throttle until I was finished. And it helped me become who I am today, and allowed me to have the achievements that I have, that I'm very proud of and very thankful for. But if I could do anything differently, I probably would have just turned it down a notch a little bit at times, and just kind of let my hair back and let loose. And well, I don't have much hair, but and just relaxed, and just enjoyed my life and the scenery around me.
Yeah, because medical school is a long process, like you said. So, being able to, find the silver lining and have fun along the way really helps you, alleviate the stress that typically does arise, like when you go through med school, right?
Oh yeah, totally.
So, I know that a lot of college students are also pretty interested in, surgery and stuff. So, do you have, and a lot of seniors too are, trying to, find their path as well in the medical world. So, do you have any advice on what students interested in medicine should look for when it comes to evaluating different colleges?
Yeah, I mean, if you're in high school, I mean, you definitely want a college that's going to have a good pre-medical program or pre-medical advisors. I mean, there's a lot of questions you're going to have when you're applying to medical school. There's just navigating the whole AMICAS process, and different interview process, and how to submit your applications, obviously the MCAT. And you want to go somewhere that has the support for that. It doesn't have to be the biggest and the best college on the planet, but it has to be somewhere that can offer support. And what I also tell kids is, college is 4 years and it's fun, but you have to feel like you belong there as opposed to fit in. And what I mean by that is, fitting in is behaving and acting in a way where you'll be accepted somewhere, whereas belonging is being who you are and being accepted somewhere. And they're very different. And I think you have to find somewhere that you're comfortable living in. If you're a big city kid, you may not want to go to a college that's in the middle of nowhere on a farm or a rural area, or vice versa. If you're from a small town and God knows wherever, you may not want to go to college in New York City, because you may feel like a fish out of water. You may not feel completely comfortable. Doesn't mean you can't go out of your comfort zone a little bit, but at the same time, you want to feel at home wherever you go to college. That's what's going to give you your maximum performance. That's what's going to allow you to reach your fullest potential. You don't want to be stressed out about life and just who you are and where you're living and being homesick, and have to study all the time, and have to worry about going, to medical school and getting into a medical school. You want to be at a college where it's kind of a seamless transition from high school. You feel good about what you're doing. You're reasonably close and can keep in contact with your family and your loved ones. But you also have that support, as I mentioned before, from a nice pre-medical team, that can really help shepherd you along the way those 4 years in polishing and solidifying your application to medical school.
Yep, absolutely. So, here's my golden question. So,
Yeah.
in be a pediatric orthopedic surgeon, what should students be focusing on right now? What courses in high school or college would benefit students who want to pursue medicine, and what kinds of extracurricular opportunities can students look for?
Yeah, and we kind of mentioned this before. I mean, I think what most people do is gravitate towards the sciences. I don't think it has to be completely gravitated towards the science, but most of what you're going to do, your coursework in high school and college, is just inevitable. It's going to be, like I said, a lot of biology, inorganic and organic chemistry, physics, and calculus. Calc 1 and 2 is what most medical schools are looking for. Those extracurricular activities are going to be um, scientific based usually, whether it be doing research, whether it be an opportunity to shadow physicians, or a volunteering program where you're in the hospital. Those are probably going to be the things that most people focus on. But if there are other things that, like I said, bring you true joy, that you're truly passionate about, that you want to do, I wouldn't discount those just because they're not necessarily medically related. Part of extracurricular activities is doing something, but it's also doing something well, and it's also growing and learning from that opportunity too. So it doesn't have to be all or nothing, but it should be probably a little bit skewed towards the sciences, but doing things that you're truly passionate about, I think will be helpful as well.
Right, indeed. Like if you like love doing something, then you'll put all your effort into it, and then good things will come out from the end. And my final
Totally.
question is, what about your job and your field do you enjoy the most?
Uh, Mostly connecting with people. I love being able to relate to other human beings. I love being able to meet somebody in a brief amount of time and connect with them on the basic of human levels and really get into their head, figure out who they are, figure out what their particular problem is, and how I can do my best to make it better. And you know, when I say connection, it's it's not about just shaking their hand and remembering their first name. It's really about meeting them where they are as a human being, making myself vulnerable and sharing my own personal experiences and opening up to them, really being empath towards them and helping them along this journey, which is the continuum of whatever healthcare problem that they have. You know, these problems aren't finite issues. If you fall and you break your leg, it's not just that day that you broke your leg that it affects you. It affects you every single second of every day till it's healed. And really connecting with people, understanding that, being empathetic towards them, and helping them navigating them along that journey in a way that only human beings can do with one another is really what brings me true joy and pride with what I get to do every day.
Yeah, connecting with patients and, kind of being like friends to them. I think that I agree with you is a really like fun part about being a pediatric orthopedic surgeon. So, audience, does anyone else have any questions before we conclude the webinar? All right, well, seeing none, well, Dr. Tanda, thank you so much for the brilliant presentation. Pediatric orthopedic surgeon is a really rewarding field. Like the process to become a doctor or surgeon may be quite long, but the reward that you get from helping someone overcome an injury or making an impact on a child's life, that is really rewarding and gives you that sense of satisfaction and makes you really happy. and
Mm-hmm.
and I really enjoyed listening to your advice and your journey toward being a successful pediatric orthopedic surgeon. So if everyone could please give Dr. Atanda another virtual round of applause, I would greatly appreciate that.
No problem. Thank you very much, guys. It was my pleasure to spend this time with you. Let me know if there's any other way I could be helpful in the future.
Yeah, I'll just quickly stop recording right now.